Good morning, everyone. On the occasion of Childhood Cancer Awareness Month, that is in September, we are presenting many patient information videos. So today we have Dr. Karthik, who is a radiation oncologist at Sri Shankara Cancer Hospital and Research Center, Bengaluru, as an expert in pediatric radiotherapy. Myself, Dr. Anand, consultant pediatric oncologist at Sri Shankara Cancer Hospital and Research Center, Bengaluru. As we all know, childhood cancers fortunately are rare, but it do happen in children. Most of the pediatric cancers, if treated correctly, they have very high cure rates. Childhood cancers are treated with chemotherapy, radiotherapy and surgery. So radiotherapy is an important modality of treatment in childhood cancers. Let's discuss some of the points about radiotherapy in children with cancer.
Thank you for having me. It's very important to give information to people about radiation. There are lots of myths about radiation. People are scared. So I hope with this interaction I'll be able to remove some of the fear in the parents and the child's mind.
Thank you, sir. So first question is, what is radiotherapy and how does it help in cancer, in any cancer?
Yeah, so radiotherapy is basically an X-ray treatment. So we use high energy X-rays to target the tumor. So what happens is, at a molecular level, at a cellular level, this X-rays goes and hits the DNA, which is the fundamental building blocks of any human cell and also a cancer cell. So when this X-ray hits the DNA, it breaks the DNA. DNA is very important for the growth of the cell. So when this DNA is damaged, the cell does not grow. So a cancer cell which needs this DNA to grow is damaged, so growth does not occur in the cell. So that's how basically radiation works.
If the radiation is helping in cancers, then how is it different to treat a child with cancer using radiotherapy compared to an adult?
Yeah, so there are different challenges when we are treating children. One of the first thing that we need to remember is, when we tell pediatrics, it's a wide age range. So you have a few months old child who can have cancer to somebody who is 18 years old who is almost an adult. So in between you have somebody who's a 7-year-old child, you can have an adolescent, you can have a teenager. So it's a wide range of age group that we are dealing with, and not everyone is the same. So treating a 6-month-old child is not the same as treating an 18-year-old child. This is because a child at different ages, they are at different stages of development. So we need to handle them accordingly. Very young age, you have to be very careful in what you are irradiating, because it can have a direct impact on the growth of the child. Whereas as the child approaches adulthood, more like 17, 18 years old, it's a lot easier to treat. Very similar to an adult, we can treat them. So this age range is one of the challenges. The second is, we need to keep in mind that the aim of treatment is not just cure from cancer, but also the child should lead a normal life. The development of the child should be normal, its quality of life should be normal, it should be at par with the other children of the same age group. So we not only have to cure the cancer, but we need to keep in mind that the development and growth of the child should also be normal. So that's why more importance should be given to these aspects when we are giving radiation.
Deliver the radiotherapy in small children, especially below 5 years old children, where they may not cooperate to receive the radiotherapy. So what are the challenges and how do you address it?
Yeah, so in very small children, the process of radiation is like this. So we have to make sure that the child remains without moving on that machine table for about 5 to 10 minutes. So very young children, say a 3-year-old or a 4-year-old, will not lie down quietly for 5 to 10 minutes. It is not possible, and because radiation is a hazard, we do not allow anybody else inside the room to stay with the child during treatment. So for very young children, this can be a challenge. So what we do is, we try to put the child to sleep so that the child does not move, and then deliver the radiation. So the first thing that we do is, we immobilize the child. That is, we make sure that child does not make small movements. For example, if you are treating a brain tumor, what we will do is, we will put a mask on the child. This mask will keep the head fixed, and once the treatment is done, we will remove this mask. So as you can imagine, a small child who is made to lie down, put a mask, the child can get very scared. So what we do is we give a small amount of sedation or anesthesia to put the child to sleep, and then put the mask and treat. So normally radiation treatments can go on for a few weeks. It can be 4 weeks or 5 weeks. So every day a small amount of anesthesia is given, the child is made to sleep, and then we treat. So commonly parents are very scared, is it safe to give anesthesia every day? So I would like to reassure them that yes, it is safe to give. The amount of medicine given is very small. The child will only be asleep for a few minutes, say 10 to 15 minutes, and then the child will wake up and they can go home. So this is one of the ways in which we handle very small children, by giving anesthesia and treating them.
So there is a phobia among the parents that radiation will cause fever, radiation will cause loss of appetite. So how true is it, and how can try to address this issue?
Yeah, so there are a lot of myths about radiation. People listen to other neighbors and similar people who have taken treatment, and they form an opinion in their mind as to what radiation actually is. So the first thing that I would like to say is that radiation is a painless treatment. When we give radiation, the child will not feel any pain. There are some side effects which can occur, but what we need to remember is the side effects are limited to the area that we are treating. For example, let us say we are treating the abdomen, then you can have some side effect like loose motions can occur. Suppose we are treating the head and neck area, then the child may have some ulcers in the throat which will make it difficult to swallow food for some time. The third, suppose we are treating the brain, the child might have some hair loss or some darkening of the skin during radiation. But these, what we call as acute effects, are all temporary. They will go away once the radiation is stopped. So that fear that there is going to be pain, the child is going to have difficulty, is not actually true.
So thanks for confirming that most of these side effects are acute, and most of these side effects will vanish after a couple of weeks. So, but I have heard that there are some long-term side effects in children who receive radiotherapy. So how are we modifying the currently available technology, or how are we utilizing the technology to prevent some of these long-term side effects in children?
Yeah, that's a very good question, and it forms the most important crux of our decision making as to how much radiation should be given. Because what is important is to know is, once a radiation has been given to the body, it cannot be taken back. So there are going to be some side effects which can be long lasting. So as a radiation oncologist, as a doctor, it is my responsibility to make sure that we try to eliminate the side effects as much as possible, and where it is not possible, we have to try to minimize it. So there should always be a balance between your attempt to cure and also your reducing the side effects. In some cases, it becomes very important that we give the radiation to cure the disease. In the process, there may be some side effects. So we try to explain to the patients about what these side effects are upfront, and then during planning we try to reduce it. So how do we reduce these side effects? So with modern technology, what we do is, first and foremost, we try to minimize the area of radiation as much as possible. So that is possible now with advanced radiation technology like IMRT. We have something called rapid arc. So these kind of technologies make sure that almost all the radiation is concentrated on the tumor area, and the nearby normal tissues are protected. There is also another advancement that has occurred called as proton therapy, which are available in a couple of places in India. That is also useful in giving the maximum dose to the tumor and reducing the side effects to the normal tissue. In our hospital, we do an additional technique called brachytherapy. Brachytherapy also makes sure that the radiation is focused on to the affected area and the nearby tissues are spared. So the basic aim of our planning is give highest dose to the cancerous cell and reduce the dose to the surrounding normal tissue. With that in mind, we reduce the side effects.
So basically, we are trying to reduce the long-term toxicities with the radiation therapy by achieving high cure rates. Yes. So thanks for that information, sir. So what are the common childhood cancers where radiotherapy is used?
Yeah, so in now majority, if you see, brain tumors are very common. Radiation is used very commonly to treat brain tumors in children. There are some tumors called medulloblastomas which can affect the back part of the brain as well as the spine. So in these children, we have to treat the brain as well as the entire spine. That is one of our more commoner cancers that we treat. The others are tumors in the brain called as gliomas or astrocytomas, which can occur in children. There is another type called ependymomas in the brain which are used. Some can have craniopharyngiomas. These are different names for different brain tumors in children that are treated with radiation. Apart from that, we have diseases like rhabdomyosarcoma which can occur in any part of the body. Another tumor that we commonly treat is called Ewing's sarcoma. There is something called neuroblastoma and kidney tumor called Wilms tumor. So these are some of the commonest cancers that we treat, and it is always treated in combination with surgery and chemotherapy. So these are some of the tumors.
So with all these modalities, with the refinement of technology in the radiotherapy, in most of the childhood cancers, we have achieved cure rates of more than 80% in the current era. So thank you, sir, for giving all this information. I would like to ask you what one message you want to give it to the families regarding radiotherapy in childhood cancer.
Yeah, so the first point that I would like to tell the family is, please don't be scared of giving radiation to the child. Our intention is to cure the child. Our aim is not to harm the child. Now with modern techniques, with expertise, with multimodal treatment like surgery and chemotherapy, we can achieve a very good dose, give a sufficient dose to cure the disease as well as avoid normal tissue toxicity to the child. So please talk to the doctor. The doctor will explain to you about what are techniques available, what is the dose, how many days of radiation has to be given, what are the expected side effects. So armed with this knowledge, take a decision. Don't just listen to other people and not take radiation because of fear or because of certain myths associated with radiation. Talk to the doctor, gain knowledge, and safely give radiation because it is a very effective treatment in curing the cancer.
At Sri Shankara Cancer Hospital and Research Center, we have this facility of providing radiotherapy for small children, including the children who are below 1 year also, under sedation or anesthesia, and we have a dedicated team of radiation oncologist, anesthetist and a pediatric oncologist who help in providing this kind of specialized form of radiotherapy in the selected subset of pediatric population. Thank you.